Hey, welcome everyone to the Internship Awareness Month session, Master of Public Health Practicum Information session. My name is Peter Bartel. We have three speakers who will introduce as well as panelists, and then my colleagues Hannah Royce and Jennifer Friend are also co-facilitating the panel along with myself. We work in career services here at the university, so welcome everybody to the presentation. I'm going to fast forward the slides here in a second, but just a heads up, this session is being recorded. Your cameras and microphones are disabled for attendees. So if you are a student or an alum coming in, we kindly do ask if for some reason you are enabled on mic, just mute it real quick, and we'll transition you to attendee shortly. The chat box should be enabled for you. It's towards the top middle of the screen. There's a chat icon. You just click that. You'll have access to the chat, and there will be plenty of time at the end for question and answer. And this session's all for you all. So absolutely put questions in the chat for the three panelists. And that's how we'll kind of carry on the conversation here. So thanks, Jen. So we'll go through the access and accommodations here at Southern New Hampshire University for inclusivity and accessibility learning purposes. I'm going to read the contacts for each of the access and accommodations lists. For online students, Online Accessibility Center by emailing oac@snhu.edu or by phone at 866-305-9430. For campus students, Campus Accessibility Center by emailing cac@snhu.edu or by phone at 603-644-3118. And for SNHU staff and faculty, the Human Resources Office by emailing hr@snhu.edu. And welcome, Tiffany, and everybody. Thank you. Feel free to put who you are in the chat, your name, your major, etc., LinkedIn profile if you'd like to. We appreciate everybody hopping on. That's joining us. So good stuff here. All right, Jennifer. So just some contact information, COCE internships at snhu.edu. And then our phone number is listed there as well. And then I think I'm going to let Hannah, take it from here.
I'll take
Jennifer,
it from here.
sorry.
Yeah. Hi there, everyone. Thank you so much for joining us today. I'm Jennifer Freund, and I'm here with Hannah Royce. We are part of the internship team at Career Services at Southern New Hampshire University. We are here to support you, all of our Masters of Public Health students. If your last name begins with A through J, I will be your main contact. And if your last name begins with K through Z, Hannah will be your go-to person. As Peter mentioned, our contact information can be found on this slide. Today, we're going to be providing a brief overview of the practicum requirement for MPH students. We will then introduce our three employer panelists who have supervised MPH students for their practicum in the past. We will hear about their organizations, and they'll provide advice for students who are searching for their practicum. Before we hear from our panelists, we want to provide some background information on the practicum, which is a requirement for all MPH students. The practicum consists of one practicum occurring over 2 consecutive terms, 20 weeks, for a total of 120 hours at the same site. It is meant to provide you the opportunity to work on a real-world public health project under the supervision of the public health instructor and an approved preceptor or site supervisor. You will need to complete a minimum of 120 hours with your practicum site over 2 consecutive terms. And please note your hours could be completed in person, virtually, or in a combination of the two, depending on your site. During those terms, you'll also be enrolled in a course aligned with your practicum experience, PHE 680 and PHE 685. To be eligible to start your practicum, students must have a minimum GPA of 3.0 and all their core courses completed, with only the capstone remaining. If you are taking 2 courses a term, the capstone can be taken with your second practicum course. Your practicum will be built and structured around the public health competencies. You and your site will choose 5 out of the 22 CEF public health competencies to focus on during your practicum. You will need to complete a practicum plan and get your practicum fully approved through SNHU before beginning. This plan will include the professional artifacts to be created in alignment with the competencies you have selected. It's highly recommended that you start your search early. Your internship administrator can provide you with guidance if you are searching for a practicum and can also guide you through the approval process once you secure a practicum. Please don't hesitate to reach out when you need assistance. Our three panelists today will also be providing advice for searching during this presentation. To start planning for your practicum, you will first want to speak with your academic advisor to determine which term you will be eligible to take your first practicum course based on the courses you have remaining for your program. Be sure to have this conversation early. Once you have spoken with your academic advisor, the next step will be to complete the pre-internship survey called the PINS. This is one of the first ways that students get connected with our team. After taking the PINS, we encourage you to spend some time thinking about the following questions. What skills would I like to develop or enhance? What type of setting would I like to explore? What kind of project might I be interested in completing? What topics or public health areas am I most interested in? Or perhaps what got you interested in pursuing this degree program in the first place? Next, we recommend that you schedule a call with your internship administrator, Hannah or me, and we are here to help you to talk one-on-one. We also recommend that you update both your resume and your LinkedIn profiles. We highly encourage students to prepare to market themselves by having both resumes and profiles up to date. Both Hannah and I can assist you and offer feedback on those as well. Well, now I'm going to turn it over to Hannah to introduce our three panelists. They have hosted MPH students for their practicums at their organizations in the past and have invaluable advice to share.
Thank you so much, Jen. Hello, everyone. So today our first panelist joining us is Aziza Todd. She is a senior training coordinator at Roots Community Health Center. So welcome, Aziza. As you can see, there is a QR code on the slide that will bring you to her LinkedIn profile. And we're also going to add the link to her LinkedIn profile in the chat for you as well. So Aziza, please feel free to say hello. We'd also love for you to tell us a little bit about Roots Community Health Center, and we'd like for you to share how a public health student may go about applying to intern there. So I'll turn it over to you.
Yeah, once again, good morning, y'all. I'm Aziza. I work at Roots as the senior training coordinator. So any individuals that are interested in internships with Roots, they would see myself and Sarah Vaughn, who's our training specialist. A little bit about Roots. We are located in deep East Oakland, as well as we have a couple of locations in the South Bay and San Jose. And we're sprinkled throughout the Peralta colleges for folks that are in like the Bay Area. But we are a community health center, so we support not just the physical health, but the whole health of individuals. So individuals may come in and need a standard checkup with their, PCP, but then also might leave the space with the, free bag of produce or diapers, or sign up for a program or a workforce program, or, get entered into CalFresh. So before our community members even step through the clinic doors, we have navigators that support with any of the additional needs, as we recognize that the East Oakland area has a very high rate of social determinants of health. So a lot of barriers economically, housing wise, the list goes on. And we're a pretty big organization. As I mentioned, we have 2 locations in East Oakland and 2 locations in South Bay. But really our goal is to service the whole community. We have an abundance of programs, from workforce development to nutrition programs, diabetes prevention programs. There's a lot of different resources that we try to provide. And if we don't have one, either we'll create it or outsource to other organizations. As far as, interest in internship placement, the first thing we need to do is just go through Roots website, look at the videos, understand directly who are the communities that we're serving, because our demographic is very, very niche. Anybody who comes in through an interview, there is an expectation that you at least know about what Roots has to offer, knows about the community that we serve. So for the internship process, you'll need to fill out an application on our, it's like, I think it's About Us or Join Us. And there's the academic portal, and you would fill out an internship application from there. Then I have my training specialist. We view our internship portal on the daily, and we send an invitation for an interview. And the interview is primarily to get to understand your interest, your experience, what you know about Roots. Really try to come in with an understanding of where you want to make an impact. What are the particular health topics and issues that you're concerned with and want to build a project around, because then we try to tailor that experience based off of the programs we provide. And if we find that there is a match, then we move forward with the onboarding process, and then matching you with your preceptor. And if it's not a match, then we always encourage folks to reapply as they can. Our internship doors are open 24/7. So if anybody is interested, even after graduation, there is still opportunities to intern. That's how we develop this pipeline to support folks. But really, the basis is having a strong understanding of what Roots is about and the communities that it serves. So I'll leave it with that.
Thank you so much, Aziza, for telling us about Roots Community Health Center and also telling us a little bit of the process if someone's looking to intern there. That was very helpful. So now if we'll just move on to the next slide, I want to introduce Shanna Livermore. She is the co-director at University of Southern California Pacific AIDS Education and Training Center. So welcome, Shanna. Again, just like on the last slide, the QR code is there, and we'll bring you to Shanna's LinkedIn profile, and we will also go ahead and put the link in the chat for you as well. So Shanna, please feel free to say hello. We'd also love to hear a little bit about the University of Southern California, and we'd love for you to share how a public health student could apply to intern there. So I'll turn it over to you, Shanna.
Sure. Greetings, everyone. I am Shanna. As mentioned, I'm the co-director at the AIDS Education and Training Center at the University of Southern California in Los Angeles. I use she, her pronouns. The Keck School of Medicine at USC AIDS Education and Training Center was established back in 1988. So at the beginning, very beginning of the HIV/AIDS epidemic, specifically to increase the number of healthcare providers who are effectively educated and trained to counsel, diagnose, treat, and medically manage people who have HIV, and to help prevent those high-risk behaviors that lead to HIV transmission. Now, as the epidemic has changed over the years, so has our center. Our activities include things like a clinical training program for physicians and NPs and RNs, lectures upon request throughout our region, as well as implementation of new programs at sites. We work closely with residency programs to train physicians and others there, but a lot of what we do is interprofessional education. So we work with healthcare professionals in general, and that includes masters of public health. It includes dentists. It's a wide variety of individuals who work in the health field, generically speaking, I suppose, to integrate HIV testing, HIV knowledge, and knowledge from the beginning of what we refer to as the HIV continuum, where we're getting people diagnosed so that they're simply aware of their status, because there are quite a few people out there who are HIV positive and don't know it, all the way through managing HIV for living a very long life with that particular disease. So given that, I take 1 to 2 virtual MPH interns at a time. It's a customized experience depending on your MPH track. So for those who are focused more on evaluation, I can do a little more evaluation. For those who are focused a little bit more on epidemiology or data, we can do something along those lines. I've also taken people who have a focus on policy. So it's fairly customizable. And for applying, you would email me. I can drop my email in the chat, or you can go through your advisors. A one-page statement of interest in the field of HIV/AIDS, and your resume, CV. I'll review those, reach out for an interview if I think there's a possible match there, and we'll talk usually through Zoom and discuss what your needs are versus what we need, and see if we can move forward from there.
Wonderful. Thank you so much, Shanna, for sharing that helpful information. So I'm now going to turn it over to our third panelist that we have today, Jessica Gorham. She is the Social Impact and Development Director at New Hampshire Hunger Solutions. So welcome, Jessica. Just like before, you'll see the QR code on the slide that will bring you to her LinkedIn profile, and we will also go ahead and put that in the chat for you. So Jessica, please say hello. We'd love for you to tell us a little bit about New Hampshire Hunger Solutions, and also for you to share how a public health student could potentially apply to intern with your organization.
Hey. Hi, everyone. Thanks for having me here today. New Hampshire Hunger Solutions is an advocacy organization. We are working at for policy, systems, and environmental changes in communities around New Hampshire and statewide in order to end hunger in New Hampshire. So we, our priorities are focusing on WIC, SNAP, school meals, summer meals, and improving access to them, and helping to remove barriers to access to those programs. So a lot of times we'll do things like SNAP advertising and outreach, but we're really working on like the systems approaches too, as far as connecting community organizations that have lower capacity with community health workers to be able to spend time at their offices where they provide direct services, helping to, screen for hunger or screen for social determinants of health, and then match people with the right services and help them apply. So it's an example of some of the systems change work that we're doing. And then policy wise, we're working to, like right now, get the state to use our simplified application for SNAP for people, older adults, and people with disabilities. And my job at the organization is to make sure we're centering our work in equity and using best practices and upstream approaches to making that easier. And then I also do a lot of fundraising as the development director. Interns, we usually have like 3 to 5 interns each semester. Well, each internship period, which I think is now like 4.5, 5 months. So it's a pretty long time that we get to work with you, which we try to make sure that interns get a project that starts from beginning to end. It is really helpful for us to know what you're passionate about. So when you send your email with your resume, letting us know what your interests are, because a lot of times we're able to customize based on interest projects. Similar to the panelists before me, we try to, like, if somebody is interested in evaluation, we can set something like that up. If they're interested in program design, we can do that. The resume is important because it helps us to match our expectations, and also to know what type of project we can give the intern. We also, we work with interns virtually and in person because we're a New Hampshire organization. So sometimes somebody's local to SNHU, they can come to we can set them up with something that's more local. So that's a little bit about us.
Wonderful. Thank you so much for sharing that information, Jessica. Great to hear more about New Hampshire Hunger Solutions. So now I do have a few more questions for the panelists, and then from there we can turn it over for student questions. So if there are any student questions, start putting those in the chat if you're thinking of any. But I'm now going to turn it back over to Aziza to start. And my question is, what advice do you have for students searching for a practicum? So I'll have Aziza answer this question and then have Shanna and Jessica share their perspective as well. So Aziza, if you want to share what advice you have for students searching for a practicum, that would be so helpful.
Yeah, I feel like across the board, we kind of like have shared that it's good to have some basic foundation knowledge about the organization. Most in like questions in an interview, they'll ask you, excuse me, what do you know about the organization? It's just, it's important to come in with a clear understanding of what the organization offers, especially when I look at organizations like Roots that works directly with the very niche population and is like directly located within that central hub. So yeah, knowing that foundation already sets up a precedence. If you've done your background research, you've done your homework, you've kind of gone above and beyond, and you also demonstrate and show that you are interested in working with or interning at this organization. Because while, you know, we have interns for a set amount of time, we are also looking for folks that would like to be here long term. So that definitely is very helpful. I think also when looking into practicums, it's important to use that experience as you know, an opportunity or a stepping stone to get into like the public health field more, right? So at my MPH program, we didn't have a practicum per se, but I was working full time for an organization where I was doing training and education. And my program specifically focused in on community health education. So I was taking what I was learning from my courses and also applying it to my work. So taking the internship is not just an opportunity to complete, you know, your requirements, but also to utilize what you're learning for the future of your career. It's really helpful and it shows that dedication. And that's really what we look for is folks that are taking this time for an internship to advance themselves in their dream career, dream field. And public health is so niche, but also so interdisciplinary that it's important to maximize the time that we have with organizations, because you might not stay there long term, but there are definitely some really great things that you can step away from and really great experiences you can step away from.
Thank you so much, Aziza. I think that's really important advice. Doing your homework is so important. Making sure you research that organization ahead of time is just so important for that interview, certainly. And Shanna, I'll turn it over to you as well to share any advice you have for students searching for a practicum.
Sure, absolutely. Completely agree with everything that's been said so far. Definitely do your research on the site. I have had some folks, because I take interns from multiple universities, come to me because they want to be a doctor and they think I work at a hospital. So confusion can lead to a little bit of misunderstandings, but definitely do your research. Think back to what you have done in the past. What have your past roles been? What classes have you taken that you just felt like, wow, that was a breeze because that really just clicked with me? To see what you liked, what you didn't like, and be real about that. Think about your passions, but distinguish that from your hobbies, right? Because you don't want to look for something that you really enjoy as a hobby, but you end up feeling like that could get you can't imagine yourself doing that for 40 hours a week, right? I love nutrition, for instance. That is one of the things that I enjoy. But when I looked into what it meant to be a registered dietitian and doing that 40 hours a week, it was like, no, that's not going to work for me. So you have to kind of be a little bit real with yourself. Apply when you're applying, be specific about your work achievements. So what is it that you have accomplished and what can you bring to the table? And put those examples on your resume or your CV. Be very clear on how you can bring value to the organization, how things match between your skill set and what the organization is looking for. It's like, wow, this sounds like an awesome internship. I really want to do this, that, or the other thing. But what that internship looks like for that particular organization might be a grant writer. And if you don't have the best of writing skills, but you're excited about the organization, it's still not going to be a match, right? And make sure all the basics are in place when you apply. your cover letter, any kind of writing sample they ask for, statement, whatever it is, that it's formatted, it's free of spelling errors. All the correct information is on there. Before you upload something, make sure that you're uploading the right version, and it is the final and not the final. Easy things that can throw you off track when you're applying for something, not just an internship, but a job. So very important. Anyway.
Great. Thank you so much, Shanna. Those are really important tips. And I like that you talked about like what value can you bring and really focusing on that, because with the practicum, the goal should really be, obviously you're going to gain so much value from working with your practicum site supervisor, but you also want to try to bring value to that organization as well. And, excellent tips on making sure you're reading through your professional documents ahead of time, submitting your best work. You can also ask your internship administrator if you want to have any professional documents reviewed there as well. So thank you. I'm going to now turn it over to Jessica for that same question. So what advice do you have for students searching for a practicum?
So I concur and agree with everything Aziza and Shanna said. I can agree more with all of those things. So I'll just say, make sure you know how much time you really have to commit to the project. I think that is really important. And make the time. If you have a busy work schedule or you're balancing too many things, like make time for your practicum, because it is, a part-time job, and there are requirements that you have to complete, not just for the internship itself, but what you have to submit to school. So make sure that you have all of those, you have your time management set. And then take a look at what the practicum requires ahead of time. Know what competencies you might be interested in completing. Like, have your paperwork ready to go, because for our organization, like, we don't complete that for you. Like, that's your job to complete that. So coming prepared to your interview after you've submitted your resume and we've set up some time is really important and really helpful, because we want to help make sure you're meeting those competencies. And so we'll help tailor your internship to make sure that happens.
Thank you so much, Jessica. That's really helpful. And yes, I think being prepared, looking at that practicum plan ahead of time before you're meeting with your site supervisor, figuring out everything that you can fill out, and then kind of consulting with them to make sure you're on the same page about what you'll be doing is really, really important, because that practicum plan is really going to be a guide map as you go through your practicum. So it's important that you put that work in on the front end so you're really setting yourself up for success with your practicum. Okay, wonderful. So now I'm just going to go through one more question. So Aziza, I'll turn it back over to you. So once a student actually has a practicum, what tips do you have for a student to be successful in that experience?
Yeah, so one thing, because I'm actually a preceptor for a student at your institution right now, and we do weekly check-ins. That means from the jump, we were like, we need to build out a Gantt chart. We need to build out X, Y, and Z factors that we feel would be beneficial to making sure you accomplish your goals. So having like those weekly check-ins, and taking initiative in that too, like saying, I want to do that so I can make sure that we're staying on track with things. And then also being flexible if things shift and change. There are some things that I didn't know needed to get done, and so we had to backtrack a little bit, and that's fine. And so making sure that there's room for flexibility when some of the outcomes you expect are not what actually happen. And then being able to, successfully, sort through those in a way that both you and the co-preceptor or your preceptor can figure out together. Because the field of public health is so up and down at times that there are so many things that can go right, and then also so many things that can go wrong. So just holding that flexibility and really working alongside your preceptor while also taking some initiative to, expect the unexpected and feel comfortable with that is the best way I can share. Yeah, it's an internship, so experience it, take it in as you need to, because I think that this is the most real world example you're going to get of like what public health looks like. And there just needs to be room for flexibility when things go really well and things don't go so well. So.
Absolutely. That's great advice. I think flexibility across the board is going to be super important. And if there does need to be a change to a practicum, that's where a student could always reach out, obviously talk to their site supervisor about it, and then reach out to their internship administrator, and we can see if we can make adjustments on our end. Because we know sometimes things do change. So that communication about that is just going to be super important. And I agree that communication with that site supervisor through regular meetings is really important as well. All right, so then I'm going to ask the same question to Shanna. So once a student has secured a practicum, what tips do you have for them to be successful?
Yeah, I definitely want to echo what's been said. Keeping that communication open, keeping it frequent. For just regular employees, I have a set one-on-one time. I always check in with them. I'm like, I value your time as well. So it's like, do we need to meet, or can we skip? And being real about that, because if they can use that time more productively in some other way to work on the stuff that they need to get done, that's great. There is no need to spend more time than necessary in meetings every week. But if you have questions, that is a great time to bring them up. But if we're scheduled to meet on a Monday every week and you have questions on Wednesday, don't hold those until next Monday. Reach out immediately and be available and responsive and flexible. If you have a major thing happening in your life, if you have a major thing happening at school, let me know. Let me know if you need accommodations. But also, as you go through your practicum, to track your accomplishments, check in with your advisor, your practicum advisor, about how to actually word that on a CV or a resume. Because you may be sitting there thinking, oh I'm just entering some data or looking through this Excel and making sure things are working right and blah, blah, blah. But that can be worded very differently on a CV or resume. And to update your resume and your CV in real time so that you are seeing what you're going to walk out the door with. Also being very diverse and pragmatic and tech savvy, kind of having an entrepreneurial attitude and curiosity about different areas that you on paper it may not sound like, maybe I wouldn't be interested in the data side of things or program planning, but let me dip my toe in there just to see what it's like. And you never know. But being ongoing with your communication and real about whether the place is a match with you is very important. Because let's say if you're an independent worker, is your practicum site going to provide that autonomous environment that you can thrive in? Or do you need something different, a different type of structure? So I think flexibility has already been mentioned several times, but yeah, I think that's very, very key, along with the communication about what skills you hope to develop, what you'd like to test out, and what kind of environment you need to thrive.
Thank you, Shanna. So helpful. And I completely agree. That communication is essential. And if a question comes up not near your meeting time, then communicating that out with your site supervisor is going to be so important, because they're not able to help unless you tell them kind of what your needs are and what your questions are. So great insight there. So now I'll turn it over to Jessica. So Jessica, once a student has secured that practicum, what do they need to do to be successful?
Well, again, we'll highlight communication, because that is so important. So everything that Shanna and Aziza said about communication is just really, really important. We can't help if we don't know. And I think to be really like direct and honest, like if you feel like you might not have time to do something, or maybe don't have the skill set to do something, to be able to say that, because I think then we can help give you the skills or the tools that you need to make sure that you're successful, and that, you know, too much time doesn't go by where you might be feeling lost because you want to ask. So I think that there's always all questions are good questions, and knowing and being able to communicate those things clearly, your needs are really important too. And then one thing that I advise that our interns, when they start with us, is to think of their internship in the method of in the form of a lab report. So when we're first meeting with them, a lot of times we're like, okay, what question are you going to answer? Like, what are you going to help us discover, learn? What outcome are you looking for? And then how did you get there? Think of that as your methods. You know, what results did you have? And then what advice might you give to, you know, to the outcome of the question, or what's the conclusion? So I think that that's really important when thinking of your internship that way, especially I mean, it may not fit all internships, but it does usually fit for most internships at our organization to think about that. And that way it's easier to turn in your report, and it gives some structure to your internship as you're working through the process.
Thanks so much, Jessica. I love that comparison to a lab report. And I think going back to that practicum plan frequently throughout the experience too is really important to remind yourself, okay, what are my goals here? What competencies do I want to achieve? What deliverables am I aiming to accomplish? So great advice there. So now we'll just be able to go to the next slide here, and we're going to focus on questions. So feel free to add any questions you have in the chat. I think we already have some in there, which is great. Peter has been reviewing those, and he is going to go ahead and share questions that have come in either for the panelists or the internship team. So I'll turn it over to Peter.
Thank you all. Great stuff so far. So we'll go through the questions now. We did have a few come in the chat. Like Hannah said, absolutely submit more. Plenty of time for them. The first question in the chat, and I'm going to open the floor to any panelists that can answer, and it can be more than one as well. Don't feel like you have to answer if you don't have anything to add. But what have been your favorite projects you've been able to work on with your organization? And whoever wants to take the floor.
I can answer that one. We've had a state partnerships for improving nutrition equity grant, and part of the grant was requiring us to provide training and to our partners, and then to help them create a plan. And so I think we had one SNHU intern and then 2 undergrad interns, and our MPH intern was able to act as a leader to the 2 undergrads, and they all worked together and helped us to co-create the learning series and carry that out. And so that was like one of my favorite opportunities working with students, creating that.
Great, thank you. It's great that you got multiple involved too. That's great. Aziza or Shanna, did you have anything to add? Or
I don't have anything, just because I'm fairly new into this role, so I can't share on Roots end, but I know from my previous work when I worked for an LGBTQ nonprofit that I had an intern who we edited our SOGI, sexual orientation, gender identity expression 201 curriculum, which was an advanced one for folks that are taking our 101. And so we worked on that for a little less than a year. But I still have eyes on it every now and then. I'm seeing that the person who's in my current role is still working with that intern to make some revisions and hopefully roll out the rest of that curriculum. But yeah, my intern completely led that curriculum down to the resources, the revisions, even supporting with co-facilitating some of our 101s, then providing feedback on what could be advanced in our 201. So yeah, that type of leadership was really, really helpful in revamping that curriculum.
great in-depth example. Thank you, Aziza. Appreciate it. So we'll go to the next question now. Brooke, thank you for the question in the chat. what specific soft or human skills are most desirable in a student wanting to complete a practicum experience at your organization? And I'll open the floor to whoever would like to answer.
I can answer. For me, I think it is I take interns remote. So it is communication skills, being flexible, and the ability to work in a remote environment. That's very different, requires a different skill set, just as it requires a different skill set to be a manager of a team that works in a remote environment. So those are our key writing skills when it comes to hard or soft skills. Hard skills, writing skills are very important. And you don't have to be able to crank out journal articles, but you do need to be able to write very well, whether you're creating a document on Canva, or you're sending a professional email, or you are writing up a project plan. So, and technology, obviously, we can work with folks, but if you walk into an internship with skills already under your belt, like SAS, or deep familiarity with things like Canva or AI, those are all feathers in your cap.
I would say that the ability, like good people skills, like good interactive, like relationship building, like being able to show up and be cheery, have your camera on during meetings. Those things are really important. Most of our work is all coalition based, and so we're constantly working with partners. And there have been a few instances where I've had interns meet with partners and then had to smooth things over afterwards because the person was nervous and it just came across the wrong way. So I think that, being able to, work through that and have those good people skills is really important. And then I would say leadership as well. Leadership skills are important. And so some of those, somebody asked if you should put them on your resume in the chat. I would say, if you have leadership skills and you think of yourself as outgoing, I think those are good things to put on your resume. That's helpful.
Yeah, because we take interns both in person and remote, though. I'll be honest, like I'm really looking to place some folks that can be in person, just because that in-person experience is really, really beautiful. Getting to meet the community members, getting to meet some of the staff that are involved in these programs, it's really rewarding. But yeah, as Shanna had mentioned, the communication skills are very different when you're working remote versus in person. So being able to effectively communicate in like a timely manner is really, really huge, because projects go by very quickly. And I think also just a level of professionalism too. Whenever we do the onboarding meeting, I go over all those documents, and one of the documents I find most important is our standards of conduct. How do you present yourself? Because we, all these organizations here have a brand to uphold, we have a name to uphold. And so when we welcome folks into Roots, it's with the expectation that you are part of the Roots family, and you represent yourself as well as Roots in a way that reflects the community and reflects that we are doing this work to make sure our communities are uplifted. And we hope that that energy is also reflected when you are interested in interning at Roots.
Thank you, all three. Awesome. I love the recurring theme of communication being important. Leadership, obviously, that was mentioned is perfect, especially right in a remote environment. I think communication is paramount. And Aziza mentioned, projects happen very quickly, whether you're remote or not. I think that's a lot to do with technology nowadays, right? So to be on top of everything, and it all ties in. So good stuff. I am of the mind as well, Aziz. I think all panelists could probably agree early on, right? There's a lot to be said for having that on-site experience to reinforce those soft and hard skills and kind of develop that work ethic. So good stuff. Thank you. Tiffany asked a great question in the chat. Thank you, Tiffany. All feel free to keep the questions coming as well. And Jerry, thanks for asking yours. So Tiffany asked, have people come with similar or the same ideas or projects from previous terms for their practicum experiences? And if so, would you be able to share some of those examples?
I can share. Generally, in my experience, folks have joined, and then we talk about what's going on in the organization and where they might fit in. They generally come with an idea of, well, I want to work in evaluation or policy or whatever it is within the world of public health. And we try to work out a project that will be mutually beneficial. That's been our approach to it, so that we get something new and unique out of it, or we get assistance with a project that is existing. So it's sort of a, I guess, more organic approach to it. I haven't had anybody come in and say, I want to do this thing. So yeah.
Our process is pretty similar to Shanna's process that she just described. So, but with that being said, and our internships, like I said, are mostly remote. However, occasionally when somebody's from New Hampshire, we do take in person. So it's usually an evaluation of some work that we're doing or helping us to like do some community engagement to inform our work. So there's evaluation pieces, and then we have had a couple of interns do training, presentations. So creating training opportunities, really learning one aspect of the work, and then putting together a presentation for one of our coalitions or something we send out to like all of our members that belong to our networks. So those, most recently, we had an intern develop a school breakfast challenge webinar series, and she worked with our child nutrition manager to develop that webinar series. And the SPINE State Partnerships for Improving Nutrition Equity project I talked about, that was a 6 different training series, and they led other people developing it. So that was also a development of that. Other interns have done surveys where they, if they're in person, they're going out to sites and doing outreach and collecting data, getting feedback from community members. And if they're remote, they're, doing surveys over the phone or emailing them. So.
Yeah, again, being a little bit new to this role, as far as internships go, the only 2 that I've placed I've placed in my role have just been the 2 that we have right now, one of which is working on a nutrition related program. So attending the food pop-ups. So he's present in person, he's attending food pop-ups, and not only doing future research on that, but also supporting the staff and nutrition team with the setup, distribution, and breakdown, and getting an understanding of the demographics that are being served with our food pop-ups, as we have 3 and they rotate around different locations. And then the other individual is working remotely on the longitudinal study, which studies the impact of Roots over the course of its inception, specifically looking, I believe, at breast cancer related work, given that was her experience, and she holds personal experience in that. So we were able to match her with the research and evaluation side of the team to support with the hopeful completion of that longitudinal study.
Great. Thank you all. We are at time. I kept this a little over, wanted to make sure we got everything addressed, but Hannah put it in the chat for questions, COCE internships at snhu.edu, 888-672-1458. And then the link is in the chat as well for future Handshake events. You may have found this event through Handshake as well. We have a ton of events that we set up, employers themselves. So thank you all for attending the session. The YouTube link Hannah put in the chat as well. That'll be recorded and shared out. We appreciate everybody attending, and we will conclude. Thank you.